heat versus ice for low back pain. I want to make this video to make it easy for you to understand which one maybe you should be using. But first, I want to tell you, you are not going to hurt yourself with either one. A lot of people seem like they're a little nervous to try either one because they think they're going to cause some kind of damage or serious injury if they choose the wrong one, and that is not going to happen. Ice and heat are both used for the same thing, which is to help relieve pain. They're not necessarily going to make injuries heal faster, and they're definitely not going to cause damage, so don't be worried about that. Now, which one should you use for pain relief? Well, here are a couple of rules of thumb. First rule of thumb for ice is it's usually used on inflammation because it causes what's called vasoconstriction, meaning it stops or slows down the blood flow in the circulation to wherever that injury or that pain is. So think things like recent injuries, think things like hot, stabbing, those sharp pains. Oh, it hurts so bad. The rule of thumb for heat is more of the chronic stuff. Think stiff. I'm tight, I'm achy. I can move, but it just takes a while for me to work that out. I think where things get a little confusing sometimes are muscle spasms, and that's probably who this video is for. With those muscle spasms, it's kind of recent, like sometimes it's like you're in that first, second, third day, there's this sharpness to it, but it's also stiff and tight. It feels seized up. So there is something, now I want to give you a couple rules of thumb with this and help you try to decide, but there is something called contrast therapy where you alternate back and forth. So what the heat does is it brings that blood flow into the area. It helps relax and loosen that seized or tight muscle. But then you put the ice on and then it helps with the inflammation. Now I think of kind of like a pump. You get that vasodilation now with the heat, and that opens up the blood flow, brings it in, but then the ice contracts it. And so now you're opening and you're closing. So that contrast therapy can work really well for that. With that muscle spasm again, if you don't know, like, if you try heat, if you feel a little more sore afterwards, that didn't do anything, we'll go ahead and try the ice. So, this is where you might experiment and see what works best for you in those cases. So hopefully that clarified thing. Either one that you use, another rule of thumb and a highly recommended is don't use either one too long, especially ice. The recommendation is usually anywhere between 10, 20 minutes at the absolute most, especially ice. Some people will say you're going to kind of get something like a little bit of a frostbite. You can get some tissue damage. Now, I always kind of say the ice packs, usually the stuff that you put in the freezer, after 20 minutes, it's not that cold anymore anyway, but just keep that in mind. You don't want to do the ice for too long. But hopefully that gives you some idea of where to start in trying to decide ice versus heat for your low back pain. If you like the video, give us the thumbs up, subscribe. You can check out a lot of our other informational videos. And then if you have any questions, leave them in the comments below.